I'm Angry Bill, and this is Pre-Hospital Wisdom. We understand that medicine's medicine, but pre-hospital providers have special skills, knowledge, and culture that other providers don't have. Let's raise the bar here a little. Do me a quick favor. Click the like button if you like this. If you really like it, tap subscribe. It costs nothing, but I would definitely appreciate it. A few weeks ago, I posted about the most important question to continually ask yourself while working through a medical call. What else is going on? What else could it be? Repeatedly working through other possibilities on your differential diagnosis list helps you to figure out what's actually going on with this specific patient. Use your history taking skills along with physical exam to exclude possibilities as much as we can. If you can't eliminate a diagnosis, you need to strongly consider treating for it. But that was for medical call. When on a medical call, it's important for a medic to think through a list of diagnoses that could potentially result in the patient's complaints. Not only the patient's complaints, but their overall presentation. A trauma call is slightly different. The main question to repeatedly ask yourself changes from searching for other causes of the presentation to what else could be damaged, what else could be hurt. In addition, where a medical call is run around the history in conjunction with the physical exam becomes much more important than a trauma call. Picture yourself arriving to a shooting scene. To simplify our scenario, let's say you're a second bus on a multi-victim scene. Your patient's all packaged and ready. He's a 22-year-old male presenting with a gunshot wound to the midline superior abdomen. What could be damaged? A short list includes liver, diaphragm, stomach, small intestine, large intestine, spleen, kidney, gallbladder, pancreas, bladder, lungs, heart, great vessels, spine, and pelvis. Essentially, anything in dude's torso could be damaged as a result of a bullet passing through, right? You don't know the path of the round. You don't know the angle of the initial impact. You don't know what happened once it started making a wound track through the body. You certainly don't know its internal path. This is an easy scenario with penetrating trauma to the torso. Blunt trauma can result in a much more complex list. Unknown mechanism trauma and trauma that involves a neurologic system are even worse. How does one check whether the pancreas was damaged by a bullet, or the heart, or great vessels? How about the liver? In the case study above, let's start with the liver, because it's pretty probable to be injured in an epigastric gunshot wound. What are the main results we would expect if the liver had a chunk of high-speed lead pass through it at about 1,000 feet per second? Pain and bleeding for the most part. Check abdominal tenderness. Is there radiated tenderness away from the gunshot wound? Are there signs of internal bleeding like Cullen's sign or Gray-Turner's sign? What's the patient's pressure and heart rate? How about the lungs? How are the patient's breath sounds? What's his respiratory rate? Does he feel dyspneic? Does he feel like he's getting enough air? Is there any chest pain away from the wound? Asking yourself what else could be damaged is what allows you to find the lumbar compression fractures in a patient who fell and landed feet first. Asking that question allows you to find other wounds besides the obvious ones. Searching out other injury patterns takes you past the distracting injury to other injuries that are harder to find. Understanding, of course, that the concept of distracting injuries is a questionable one. I already have a rant about that. It's around somewhere. Asking the question is what allows you to broadly use the trauma mechanism to guide your patient care. It's what makes it harder for a change in status to surprise you. I bet you already correlate mechanism of injury to physical exam. Think about how you focus your exam when you find a starred windshield. You already do this. You see the windshield and essentially think to yourself, what else could be hurt? Realize that we don't have ultrasounds, CT scanners, or X-ray capabilities. All we have is our hands, ears, and eyes. Tongues and noses too, but that's nasty. That is what makes a physical exam so crucial to pre-hospital success. Use your hands, ears, and eyes to search out anything else that could be hurt. Medical calls are a search through possible differential diagnoses. Trauma calls are a search through possible organ system injuries. It's slightly different, but the same general idea. In both cases, a great paramedic goes beyond the page in his or her protocol manual titled Penetrating Trauma or Chest Pain to actually think through the pathology of the specific call. Let me know what you think of this. You can certainly comment, get in touch with me however you like. If you found any value at all from this video, click like and subscribe below. One of the most helpful things you could do is share this content with someone you know. Click over here for another video, or click over here for the channel page and all videos. Subscribe's the button below, and I'm trying to hit 1,000 subscribers. I'm Angry Bill. This is Pre-Hospital Wisdom. Till next time, stay safe.